beautiful spotless skin team, and I'm sure all of you must be doing really good. So today we are doing this Insta Live, and the topic is very important, very interesting to deal with, and the topic is related with acne. Now acne is something which most of us has gone through that phase of acne vulgaris during our teenage or when we were young adolescent. But then it's so important to understand why acne happens, how to prevent it, how to deal with it in case we have an acne prone skin. Now, again, those who have oily or acne prone skin, they also find it very tough to deal with acne because it's such a common chronic skin condition. So it becomes very important to understand acne and acne management. So today we are going to talk about acne management, and the skin expert is Dr. Mahima Wadhwa, who's going to join us from Delhi. So Dr. Mahima Wadhwa holds an MD in Skin and BD from Government Medical College, Baroda, and an MBBS from Kasturba Medical College, Manipal. She specializes in clinical dermatology, including the management of acne, pigmentary disorders, and alopecia. Dr. Wadhwa has extensive expertise in laser treatments, peels, dermatosurgery, and cosmetic procedures such as Botox, cryotherapy, etc., etc. Her academic contribution include co-authoring chapters in medical textbooks and publications in peer-reviewed journals. Dr. Wadhwa has also presented award-winning research at national conferences and has actively participated in various dermatological workshops and courses. So today, Dr. Mahima Wadhwa is going to join us shortly, and the topic is going to be acne management, how to deal with acne in the correct way. Now, the most important part to understand is that in case you have acne, or you have oily skin, or acne prone skin, you need to go to the right person, which is a qualified dermatologist. So that's very important to understand, because what happens in our society, we are so obsessed with over-the-counter topical application, over-the-counter treatments, just by going to the nearby chemist shop, asking for something to take care of the acne. Or then we have home remedies or DIYs by various social media influencers or our friends, family, relatives. They all come with their own suggestions, informations, etc., remedies. But then it's important to understand that it can be really, really hazardous for us. It's important to understand the root cause, why acne is happening, so that we can prevent or make our skin barrier more strong. So what should be a basic good skincare routine that we can go for? Or there are so many things. What to eat, what not to eat is again a very important topic. People often wants to discuss whether we can do makeup or not. What is a basic skincare, minimalistic skincare routine that we can go for? So these are the dimensions that we are going to cover in this live session, where we'll be talking about acne and acne management. Now, what are the various types? Because many times we see these small bumps, black heads, white heads, what we call as layman, or we have then they become a little more severe and they become more bumpy. Then we have these pus-filled acne. Then we have these really big, painful acne. They look like cysts. So, what are the various stages of acne is again going to be a topic of discussion. So what is acne, how to prevent acne, how to deal with acne, how to make our skin barrier more strong is going to be the topics that we will going to cover, along with other questions. And in case you have any questions related to this topic, acne management, please feel free to ask it in the comment section. Please ask your question. We'll try to take it during the Insta. And here we go. We have with us Dr. Mahima Wadhwa. Very warm welcome to you, Dr. Mahima Wadhwa.
Thank you so much. Yeah, so you can hear me?
Yes, absolutely. Loud and clear. So, doctor, today we are going to talk about acne management. So without wasting any time, we would like to just understand what is acne, why it happens.
So basically, acne, it's a very common skin disease or entity. So acne is a chronic inflammatory disorder. So initially it was more of an adolescent age group problem, but as we all know, so these days it also affects the post-adolescent age group, commonly known as hormonal acne or adult acne. So basically, it is a disorder of our pilosebaceous unit, and it is an inflammatory disorder. And normally, the patients who present with different grades of acne, and broadly we can categorize four grades of acne. So initially, patients come to us with comedons. So those are like the layman language would be whiteheads or blackheads. So that is grade one. And when it advances to reddish papular eruptions, that is grade two. And grade three is when it progresses to pustules. So papules, pustules, comedons would be grade three. And grade four is pseudocyst formation. So that's not a typical cyst, but because that's why we call it a pseudocyst. Or we also call it nodulocystic. So these are the basic
Okay,
of acne. And now no more we can say it is just present in adolescent age group. It's no age now. A lot of patients with acne, 40s, 50s, are coming up when they are nearing the menopause. They get acne in their jawline area. Yeah, so it is no more a disease, I would say, of adolescent age group.
So these patterns also tell us something, as you said, right? That if you have jawline acne, there are more possibility that you are having it due to hormonal changes. Many times, doctor, you see these small bumps around the forehead.
So forehead is more of actually because of the seborrhea or the oiliness of your scalp. Commonly patients suffering from seborrheic dermatitis or dandruff basically. So a lot of they have these small bumps, which is more of a ptyrosporum folliculitis or fungal acne, basically commonly known as in layman language. So that is because of that dandruff. Mostly because you will see patients ki the whole face is clear, only the forehead and eyes they have few eruptions. So that is
True.
more suffering from dandruff. Also, these kind of patients have eruptions on the back. Fungal acne is also there. So in these cases, we should try to figure out if they are suffering from dandruff. That is a very important question. And also if there is chronic application of oil. So that has to be figured out from patients who are coming only with forehead acne.
Yeah, because it's we are really obsessed in our society, oiling our scalp and keeping it for hours and hours is a very big obsession. So you are saying it's not a very good thing to do, right?
Because even in my family, my mother-in-law would always say, you should apply for dandruff. This is a very common thing, and I feel now that has come down because people have started visiting dermatologists. So now when we tell this to a patient that don't apply oil if you're suffering from dandruff, they are okay. They understand and things are there. But initially, तो I said, what are you talking, doctor? मतलब oil नहीं लगाना है. Now the acceptance is much better.
Very well said.
They know कि oil नहीं लगाना है if you're suffering from acne or dandruff. Now it's known.
Right, absolutely. And doctor, we often get to hear that you need to follow a good skincare routine, which you can be more consistent with, so that you make a good skin barrier and prevent or minimize the chance of acne formation. Now, what could be a very basic, minimalistic skincare routine that we can adopt?
Now, basic would obviously start with a cleanser, moisturizer, sunscreen. And see, now patients suffering from acne, they have this notion that we don't have to apply a moisturizer. It's a
Ah,
common, they feel, my skin is already so oily, why should I apply a moisturizer? So now
right.
that's a very wrong notion because when you are suffering from acne and your patients are almost, if they're not even visiting a doctor, they're usually applying a lot of things. They are applying over the counter creams which are available, or they're even doing home remedies, aloe vera gel, very common, multani mitti. So, all these things are going to cause a lot of dryness and they disrupt your common skin barrier. So, obviously, moisturizer is a must, and that also a barrier repair moisturizer is a must, and especially in acne prone patients because otherwise they are going to just come with they usually come to us with dryness, redness, irritated skin when we give them the skincare products for acne. So basically, they have to follow a proper regime with a moisturizer, which should be non-comedogenic, and most of the medical grade moisturizers which are available these days are non-comedogenic. So you have to see that, and also along with that, a proper sunscreen. As far as a cleanser is concerned, of course, most of us we prescribe a salicylic acid based cleanser or even benzoyl peroxide. But sometimes these cleansers can be very harsh on the skin, especially now with the weather changing and with winters coming. So they can be very harsh. So at that time, we do prescribe them non-salicylic acid-based cleansers because then it disrupts the barrier. So that it has to be seen according to the patient's skin what is required. But a basic regime is a must. Which three basic things: a proper cleanser, moisturizer, and a sunscreen.
Cleanser,
That has
moisturizer, and
to be there.
sunscreen.
And if you are applying regular makeup, please apply it on top of a sunscreen. One should not apply it directly because obviously once you apply sunscreen, it creates a barrier. So that prevents acneiform eruptions. And but yes, makeup is one common cause for acneiform eruptions. If a patient is regularly wearing makeup, especially we get a lot of air hostess patients who are
Right.
long hours of makeup and they have to do makeup. I mean, they sometimes it's like the profession doesn't allow, so they have to do it. So in those cases, then it has to be that they can apply it on top of sunscreen, proper cleansing of makeup. You should try to double cleanse first, clean your makeup with a cleanser or a micellar water, and then wash your face. So these are few precautions which one can always take. Apply a moisturizer before going for acne.
Right. So you need to follow these very basic steps, and in case you are confused what to buy, please go and consult a qualified dermat. They'll help you in choosing the right product as per your skin type, as per your skin condition, as per your skin issues, etc. So please don't fall for the market gimmick because market is flooded with products. Every second person is endorsing products. So don't do that. Go to the right person again, especially in case you have some skin related issues like acne. Now, doctor, another thing, we are very obsessed with is home remedies, DIYs, topical application, these over the counter topical applications. एक acne हुआ नहीं कि हम सबसे पहले chemist shop पे चले जाते हैं भैया पिंपल हो गया है कुछ दे दो लगा दो तो we are so obsessed with this. Doctor in our list comes very late, though with now with so much of information, awareness, everything, people are taking it seriously and going to the doctor, but still home remedies, DIYs, over-the-counter topical application, they do have a place in our minds. Are they, working or good, or can they cause more harm to our skin?
See, of course, if you're using triple combination, a lot of they use over the steroids for acne. See, steroid is a wonder. It is an anti-inflammatory. So, whenever it's going to apply it on your eruptions are going to smooth out, and the redness will reduce, your itching, whatever compromised barrier you are having, it will get sorted. But on a long term, it is going to harm your skin because it's not going to cure your acne. It's not the cure. It is just suppressing your eruptions. So sometimes patients, especially steroid on, they keep applying it over their face and feel very. They say, "Ki I stop, the eruptions come back." Obviously, they are going to come back. And on long term, of course, everybody knows steroids have a lot of side effects. Topical steroids. See, again, as I said, I don't know how these patients are applying steroids because if we prescribe a steroid, then they're jumping like, why steroid? Go doctor, you have written a steroid.
True,
Even
true.
required, and
Uh,
we write a steroid, the patient, questions us back and forth. But I don't know how
mm,
some patients are applying, even not only like from like, educated patients, they are applying steroids for their acne and for many other medications. So that time, and they are very comfortable with the fact that, keep applying it because they don't realize what side effects it's causing. It can thin out your
true.
skin, it can cause hypopigmentation, it can cause a lot of dilated blood vessels over your skin. So these kind of things will happen, and so one should not resort to these things. But because long term, they are not going to help. They are going to damage your skin, make it more sensitive to the sunlight. So yes, one has to stop using these products.
Right. When we ask somebody why you are not going and consulting a doctor, they'll probably say they'll, prescribe some steroid or chemicals. What you are doing yourself, buying steroids and applying at least doctor know how to give steroids, how to taper it down, etc. Right.
Right.
So this is a very practical
I
point.
have got patients that they tell me, doctor, steroid mat likhna. And I ask, what have you been using? They have been using steroid and they don't know. So that is one thing one needs to consider what they are using. It's like because we have got famous, dermatologists, they will do, uh, has to see what they are using themselves also.
Right. Doctor, what are the treatment options and procedures available for both acne management and post-acne, these marks and scars?
Right. So, see, of course, acne first, there has to be a medical management, and we do have procedures also. We can intervene, but so now your dermatologist is going to be the one who will know when to intervene with the procedural dermatology or just the medical management. So, medical management, of course, would include oral medications as well as topical. Now, topical these days, of course, a lot of patients already know a lot about adapalene, benzoyl peroxide. They know all about this. But again, overuse, underuse, all these other problems. One should know how to use the product. Even with when we prescribe, sometimes we get calls that, I'm having a burning sensation, having itching. So again, side effects do happen, but one should know how to manage them firstly. Secondly, we need to many times give oral medication to stop the acne scarring and the pigmentation or the PIs that will be the result of acne. Basically, acne will not do anything. It will subside. More or less, it
True.
is going to subside. आप कुछ नहीं भी करोगे तो एक पिंपल दूसरा आ जाएगा दूसरा हो
Mm.
जाएगा. But the problem is the residual pigmentation it causes and the scarring. That is the concern. Sometimes it can be really scarring acne if a grade 3, grade 4 acne. So we have to
Mm.
manage that, and for that we have to give the right treatment, which will be in the form of oral medication as well as topical. And sometimes in grade 3, grade 4 acne, we need to do certain measures. We need to do chemical peels, and in fact, microneedling. A lot of things have to be done. Now, when that has to be done, that depends on the patient's condition. So this is as far as medical management is concerned. Once the acne is cured and there are no more eruptions for a period of at least 3 to 6 months, then we can go for the scar management, pigmentation management. Though my treatment, once the patient's pimples have subsided, I do start with the pigmentation management, scar management in the middle because patients are very impatient. I mean, they are once the acne is subsided, their scars start showing. They are more visible than back.
Sure.
They're more concerned about pimples. चले गए, but then they are like कि अभी scars ज़्यादा दिख रहे हैं. So one has to again start the treatment. Also has to see the patient's temperament. So that can be decided by the doctor when to start. Everybody has their own way of management. But as far as
Mm.
scar treatment is concerned, we have a lot of available from the machines to basic subcision. If once we didn't have the machine, we were doing basic things like derma roller, microneedling, and subcision. But now that we have lasers like laser, we have microneedling, RF, we have other non-ablative lasers which can be taken along with chemical peels which take care of the scars.
Right. So there are treatment options, procedures available, but one important thing, viewers, you need to take care of is to go to again the right place to get the procedures done. Because if in a neighborhood parlor wali auntie will claim to do it or salons etc. Please go to a clinic, go to a qualified dermatologist, and only under their supervision get the procedures done. That's very important. Doctor, one last question. Any dietary precautions? Because many times we correlate acne with what we eat.
Yes. So, more than fried food, it is more of milk and dairy and high glycemic index food item. Patient they come to us, I'm not fried, I'm not. Basically, it's not. अगर आप घर का कभी कभी खा लो, that's fine. It's the junk which you have to avoid, which is the high glycemic. अभी high glycemic is not just sugar. They say, I don't take chini, I don't take sugar. That's the most common thing. But they are consuming a lot of high glycemic index products, junk, especially preservative food items like biscuit, chips, namkeen. These have to be stopped. And dairy. Now, when we get a lot of children, as you say, milk and dairy has to be avoided, they get very happy. And they're like, milk nahi peena and all. So, the mothers are very like, doctor, we don't have to give them milk. So now that has to be again need to see what can be done about that, because milk again.
Right.
I always tell my patients balance it. It's not like कि आप बिल्कुल ही dairy omit कर दीजिए. And in case
Right.
the acne is not getting controlled at all, and after long term treatments also I'm getting a lot of eruptions and scarring. So then that's where I tell the patient to completely stop milk and dairy. But usually I tell them to balance it. Excess नहीं होना चाहिए, but it's not like कि बिल्कुल. And of course, in case somebody wants to, then you can go for other options like almond milk, soya milk. These are the other options. So, and mostly hormonal acne, patients suffering from PCOS. So, in those cases, adult acne, one has to be very cautious with their diet and exercise, because that is what is going to correct your hormonal axis. So, those kind of patients, I always tell them, our treatment is only giving you time to correct your lifestyle. It is not permanent cure. Permanent cure can be done only by you. You have to correct your lifestyle, because basically hormonal acne is a lifestyle disorder. So one needs to correct their lifestyle, sleep on time. These days, patients are like, 2 बजे से तो पहले कौन सोता है. So that whole
Right.
scenario is causing a problem. Why has adult acne become, as I said in the starting, there is no more any age. कोई एज ही नहीं रह गई अभी acne की. All categories we are getting, starting from the early age, adolescent age to 50s also. Yeah. That's because
Mm.
our lifestyle, again, of course, we are living in a very polluted, adulterated environment. So that cannot be done, but we can try to correct our lifestyle at least, because that is where you will be able to control your acne. Otherwise, you'll be going from hopping from one doctor to the other. That's
Very well said. Very well said. And doctor, before we conclude, any take-home message for our viewers?
So yeah, I would just suggest patients that please don't self-treat. That leads to further scarring and pigmentation. You visit your dermatologist, get a proper regime, and know what to do. And most importantly, what not to do. That is more
Yeah.
important than what to do. So I think should I mean, doctors nowadays, everything is very easily available on Instagram. People follow that, but then again, the proper, that is just a generalized. Now I am also here talking about a generalized acne treatment, but it has to be tailored according to the patient's need, patient's skin. So that can only be done by a doctor with a proper consultation. So one should always go for that and then go forward with the treatment.
Absolutely. Thank you so very much, Dr. Mahima Wadhwa. It was wonderful talking to you. You made everything so clear to us regarding acne management. Thank you so very much once again.
Thank you so much. Thank you for inviting me. Thank you.
Thank you, Doctor, and viewers. Thank you for joining us. Stay happy, stay healthy, and take good care of yourself. Have a great day ahead. Goodbye.